It's okay.
All right, and welcome everybody. This is Barney Kunze, and we're back with another live weekly coaching call. We have a great presenter on with us today. All of the presenters and people that come on are special, but this one in particular, Eva has done a lot of great work for the Animal Summit and just in general. I'm going to bring her on here in just a minute, and while you guys are all coming on, or coming in rather, I'm just going to let you know that we have quite a few questions that have been submitted. And then as you, so if you're here live and you didn't submit a question, go ahead and post it as a comment, and we will do our very best to get to it, because when I'm not talking, I'll put Eva on the screen, and then I will be helping her to moderate. So really excited to have Eva. I want to tell you the story before I bring her in. Is that it was April 2017, and I was in Phoenix, Arizona, and I was at a marketing conference, and I met this guy. Jamie, my assistant, who many of you probably know, who's amazing by the way, came with me, and she does not like crowds or a lot of people, but she came with me to this marketing event called PLF Live, or Product Launch Formula, and it's basically put on by this guy, Jeff Walker. And long story short, we ended up sitting next to Dr. Andrew Jones, who is from BC. And Jamie's like, "Oh, you're never going to guess who I met. He's this, blah, 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 this really cool guy from BC. And he's very interested to hear what we're doing with the Animal Wellness Summit." And then I talked to somebody else, and they said, "Oh, hey, I just ran into this lady. She has this really cool device you should take a look at. And she'd be great for your summit." And I'm like, "Oh, this is awesome." And I met Carrie. I met 2 or 3 presenters actually at that event. And so this just goes to show how amazing just going out and networking, rubbing shoulders can kind of impact and just change the trajectory of your life. And so the reason why I wanted to share this with you is because, like, right at the tail end, I happened to just bump in, and I say just bump into Eva on the way out. Everybody was having drinks, just kind of like the event was finished, and people were flying out, and people were socializing, whatever. And then I said, "Great, this is awesome." And so then we met, talked very briefly, and then I grabbed her little pamphlet, and then it was like 2 or 3 months. And then I'm like, I'm going to reach out to that lady. And then I think, Eva, you can confirm for me when you come on here, but I think she actually then reached out to me, and I'm like, "Oh yeah, I remember. I have your pamphlet." And long story short, I think Eva has the record so far of referring the most presenters to us, and we're really appreciative of that. So I'm going to bring Eva on here, as I really did a good job trying to butter you up here, Eva. But I just wanted to share and say thank you for coming on here today, because I know there's lots of great questions, but I just thought it'd be good to remind us both how we first met and where we are now, and how much has been accomplished from that, little meeting of just happening to run into each other in Phoenix.
Thank you, Barney.
Yeah.
That's sweet of you.
Yeah. So thanks for taking the time to be on here today. And just in case there's some people out there that are wondering who you are and what you do, just go ahead and give us a brief little overview, because it's always helpful, because there's a lot of new people that have come into the summit this year that weren't here last year. So just give us a little overview.
Have we a limited time just for me to know?
Yeah.
Okay, so I'm Eva Servais. I'm from Belgium, but I have been living in Spain for the last 15 years. From profession, I used to be a lawyer in Belgium, but animals have been in my life always. And that's also why I studied law, because back then I wanted to become a vet, but my father was a doctor and he was never home. And I said, if I'm going to be a vet, I will never be at home and I will never have a family. So I said, okay, let's do something else. And I did law. Back then it was, what was that boat called again? Green, what was the name again? Fighting for the rights of the animals and so on. So I said, okay, I'm gonna study, what?
No, I was just acknowledging what you were saying.
Okay, so I studied law. I worked as a lawyer. Sadly, I never got into the business of working as a lawyer for animals, because that just didn't happen over there. But so I came to live in Spain in 2003. And I continue to work here as a jurist. I have my own office at home. I have a rescue center. I have been saving animals all my life, and I have a rescue center, a non-profit rescue center at my place, where I save abused horses and dogs. And how I got into photonic therapy, well, that's not so nice to hear or whatever. I had a severe motorcycle accident in 1994, and since then I've had quite some physical and mental challenges. And then I broke my back. I have a disease in my knees, which is called chondromalacia rotuliana. And I was tired of this life, because when you have fibromyalgia at the clinic, they say, well, it's time for you to accept that you have this, and it will be for the rest of your life. Mm-hmm. Take those medications, adapt your life, and that's it. And I said, I'm sorry, this can't be it, because if this is it, I just don't want it. So long story short, while I was recovering in my bed with a broken back that I broke with a fall with my horse, no, he didn't throw me off. I just was on the internet, and I suddenly saw a message from the blog from Linda Pirelli saying she had a fall with her horse. She broke some ribs, and the day after she could go out of the hospital without pain thanks to the torch. So I said, I have to know what this is about. And so I started digging into this. I found Dr. Brian McLaren in Australia, who is the originator of the therapy, photonic therapy. And so I talked to him, I got his torches, and I started to be his student. He was my mentor. I went to do the levels, and I had a very personal relationship with Dr. Brian McLaren. We were continuously emailing to each other and talking to each other. And I have been teaching this since 2009 in several European countries. So during the week, I was doing my job, let's say this way, as a jurist or as a translator. I would take care of the animals here. And in the weekends, when I had time, when I was free, I would go and teach this, because there is nothing better in this world than to take the pain away. And certainly, people like me who have been suffering for so many years know the value of that. So I wanted to introduce this in Europe so people would know it, and people would know they could do something for themselves, and they could do something for their animals, because you don't want to see your animals suffer. So that's how it all began. And over the years, I've been certified since 2010. And then sadly, in 2016, Dr. Brian McLaren died. And as I was the highest qualified, and he was my mentor, because of the relationship that I wanted to know everything about it and build up a library with everything he was doing, the family asked me if I would continue Brian's life work. So since the end of 2016, I am now leading this, but I don't see it as a business. I see it as a continuing the life work of Dr. Brian McLaren. So that's my introduction.
Yeah, that's great. I know you mentioned that before, and I just think it's pretty awesome in the sense that I think at first glance, people look at it and they're like, well, what the heck is this thing, and how does it actually work? I know that your presentation in the last summit in 2017, you explained in depth how it works. But there's a couple questions. We'll get into that, because there's lots of questions here, some good ones. First of all, just this is an easy one from Jessica, but do you run courses in Europe?
Yes, of course. I either go and give weekend courses for people who just want to know something, how to use it on their animals or on themselves, and just want to know the basics of what to do and when to do it. So these are weekend courses that I do. And then on the other hand, I also have certified courses, which are partly online. And these are really, this is a course of a year. And the people who finish them, they can become a certified photonic practitioner in their country with liability insurance. And for that, we have every single country, as far as I know, for Europe, for America, for Canada, for Australia. So all these countries are covered, but you have to do the work. And I can tell you, not everybody finishes my courses, because this is really, I'm going to teach you everything there is to know about this, so you later on can do this. But that is really just for people who want to be doing this professionally and ask money.
Right.
Our pack what Dr. Brian McLaren has developed, anybody can use it. You don't have to study anything. You don't have to know anything about the anatomy. Let me give you an example. So, for example, yeah, that's the torch. But for example, what Dr. Brian McLaren has done, he has prepared all the booklets for any kind of disease. So, for example, let's take, you just go into the list and you look up the booklet that you need. You open it. This is, for example, for colic, for horses. You just have to see where to put the light. So this is the light. You just have to see where to put the light on the animal. And Dr. Brian McLaren explains it also where it is. And you can do this by yourself. I mean, 99.5% of our clients have never ever studied anything, because this is delivered at your home without you having to know anything. Just look it up, do those points, and it will work. But you always have people who want to know more. Like for most of my courses that I give for the weekend courses is people with horses. They are afraid for their horse to die of colics. So they want to know what they have to do in cases of emergency. They want to know what solutions there are for their animal with arthritis or arthrosis or any chronic disease. What can I do? What can I do from home? And how can I help my animal? So yes, we do courses. By the way, before I forget it, next week I will be starting again with my webinars with all the explanations for the online courses and the certified courses that will start in January 2019. I only offer those courses. I only offer them once a year because they take a year.
Right. So basically you do the, I'm off the screen. So you do the live version, live training, of course, for those who really want to dig deep, and then there's those like somebody like me who, you know, have a thank you, by the way, Eva supplied me with a torch, and to be able to use it. And then it's pretty straightforward, because I mean, I come from the holistic healing world in health and fitness, mainly for humans. And when I remember getting it, thinking like, well, am I going to overdo it, underdo it? I liked how simple it is, and that it's just easy to use, and that the instructions that come with it are pretty straightforward.
Yeah, it's not dangerous. You can't do any harm, and it can be used on any living being. So you don't have to be scared, like with lasers, for example, that your child would take it from the table and look in it and damage her eyes, for example. So as long as you're using a medical LED light at 660 nanometers, that's not stronger than the 500 like we have in here, then you don't have to worry. You can't do anything wrong. So right. That's what's really important, because it's safe to use.
Right. Okay, great. Well, let's so first of all, those of you who are on here who are not members, or you didn't take part in the summit, Eva has great training on her website. But for those of you who are, of course, members, whether VIP or Platinum, or if you have the downloads, go and watch Eva's presentation if you haven't yet, from 2017. It's pretty phenomenal. And if I recall correctly, it is quite detailed in the basics of explaining it from, like, you know, start to finish. What is it? How it works? And so I think what we'll do is jump into some of these questions here, and confirm for me that I have up here, that's the proper site. Yeah.
Or they come whenever they want to, they will be referred to the same one. Yeah.
Yeah. So I just went to advancedphotonictherapy.com and then redirected, which is perfect. So this one here from Kathy. So let's start going through some questions.
Okay. Now, before I'm going to answer this, for those who haven't seen my presentation, in 1 minute, I'm just going to explain what photonic therapy is.
Yeah, that's good.
Photonic therapy is the use of a specific medical LED red light at 660 nanometers, which we are going to put on specific acupuncture points. So in short, you could say photonic therapy is like acupuncture, but without needles. We are doing the same. We are giving our animals like an acupuncture session, but by stimulating acupuncture points, but without using needles. We're not making micro lesions. So that is what photonic therapy does. We're using a specific red light to put on specific acupuncture points to get a specific result. Okay, so that's one. On the other hand, photonic therapy can also just use red light, meaning you can torch locally. So for example, your elbow is hurting, You can just take the red light, put it on mode 2, and slowly go over the zone where it's hurting. And then it will be used like a painkiller. It's as if you're taking a paracetamol, and for X hours that pain will slowly go away. So in other words, photonic therapy is not red light therapy. Photonic therapy is red light therapy in combination with the stimulation of acupuncture points. So we can do a lot more than just red light therapy. Okay, we can go as of to acupuncture, but without using the needles. Okay, there was a question about a cat, but it has.
Yeah, I just thought I'd put your setup
okay.
on top of it.
Can you help cats who aren't responding to pill therapy for hyperthyroidism and one with a brain tumor? Okay, so these are two different categories. What you have to remember is what photonic therapy does, or what acupuncture does, is we bring balance in the body. So whenever something is not in balance, by stimulating specific points, you can bring it back into balance. Now, in a general response, Katie, to you, a general response, and for everybody, if you're ever in doubt if photonic therapy can help your specific case, I always say, just go to Google. Go to Google and type in the disease that your animal has. And after that, you say acupuncture. And then Google will tell you if acupuncture can help with the disease of your animal. If acupuncture can help, then photonic therapy can help. So this is always a way to check out what's possible. I can tell you, Katie, that yes, photonic therapy can help your animal with any kind of disease. The thing you have to remember is the following, is that there are some situations where we can heal the patient. There are some situations where we cannot take the disease away, but where we can take his pain away and make his life comfortable again, and with joie de vivre. And that's also what you have to remember. I'm going to give human examples. For example, if I hurt my ankle right now, maybe I'll have to torch myself once or twice and I will be fine. So I have healed the problem, okay? But I have fibromyalgia, and they say that's an autoimmune disease. You will have it for the rest of your life. Fine. So I keep my title of fibromyalgia. I can't get away from that, they say. But I'm working more than when I was 25 years old. I can do more. And any problem that my fibromyalgia would give me, I can torch that away. So if I would have stomach problems, I can torch that away. If I have a headache, I can torch that away. I can give myself more energy. When usually when I was 25, after my 27, when I had my motorcycle accident, I was working 2-3 hours a day, and for the rest I was lying on in the morning I would go in pleat. In the afternoon at my office I would lie on the floor just to recuperate, because I had fibromyalgia. I didn't even know that the term was like that. But and then at night I would work a bit again. Now I can work all day because of the thoughts. I'm keeping the name of fibromyalgia, but I have a decent life. I can do whatever I want to. So for the hyperthyroidism, yes, we can help you. The one with the brain tumor, with animals who have cancer, you always have to make a choice. And I explained for the following. If I have an animal, which I had in the past, if I have an animal of 14 years old who has lots of problems, and that dog got liver cancer, well, you have a choice. Are you going to give him chemo? Are you going to give him painkillers? What do you want to obtain? In my case, for that dog, who was already very old for his age, I just wanted to give him the best life he would have for the remaining months he would have. In other words, I would not start with chemo or anything anymore, to try to give him a few more months in which he would be sick most of the time because of the chemo. I didn't want that. So in that case, I would use photonic therapy to make sure that he had no pain, wanted to run, had pleasure in his life for as long as that was possible. So if you have a 20-year-old cat with a brain tumor and you just want to help him have a good life as long as it takes, yes, no problem. If you want to reduce the brain tumor, I cannot respond to you because we have never done that on a cat. But I do know that we have the little tumors on horses, for example, that we have been reducing. Do you have to be afraid for the use of photonic therapy because she has a brain tumor? No, because photonic therapy is going to give the energy to healthy cells. It cannot, and that's a lot more technically or scientifically that I cannot talk about that tonight, but you don't have to worry that you're going to make it worse. We are bringing things in balance. We are helping the body and the brain find balance. In other words, if you're fine and you're doing the diarrhea points, you're not going to get diarrhea. No, it's when you have problems in your intestines and you do the points, it will help you get better, but it can never make you worse. Okay.
Yeah, that's great. That's great. Let me pull this back up here. That was very good and very detailed. And fellow presenter Christina Chambreau is on here. She was just supporting what you're saying and saying that all holistic modalities like this can help any problem, but not every individual. And I would agree with that for sure.
Yeah, absolutely.
And then she said for sure, because somebody was asking earlier, so I want to pull this up about with dogs with arthritis. It was the first person, actually, the first question rather, from Ma Fei, is that my dog has arthritis. Can the torch help me?
If you go to my presentation, or even if you go to my Facebook page, Whispering Ranch, that's from my rescue center, you will see I have here a dog. And she was in the presentation. She's called Gypsy. Gypsy has hernias in her neck. She has hernias in her spine, in the thoracolumbar discs. She has hernias in her lumbar. She has severe arthrosis with deformation. She's a rescue dog with deformation in her elbow, coming from arthritis, going to arthrosis. We didn't know that back then. She is not on any medication. And you can see videos. I used that video too in my presentation. You can see how from one moment when she was in pain, when we found her in pain, and I torched her, how she was 15 minutes later. Okay, so it can help with arthritis. The thing you have to do if you have a torch, to help with arthritis, you want to do two things. You want to stimulate bladder 17, is a specific acupuncture point that you can find in the booklets. But you must at that moment also torch the specific points for the part of the body where he has the arthritis. So if it's in the front leg, you take the front leg points together with bladder 17. If it's in the hip, like hip dysplasia, you can do bladder 17 together with the points for the hip. So no problem. I think if I am honest, I think that over 60% of our users have bought the torch for arthritis, because general or traditional medicine will say no. If once you have this is already chronic, and whatever is chronic, you can't change that anymore. Yes, you can. Absolutely.
Yeah, that's great. So that, pardon me. So that was about asking about the dog with arthritis, but then of course the same applies to cats. And now the points, Eva, this may be a silly question. I'll put myself back on here. But my joke is it's only a silly question unless you ask it twice. So I'll be careful to only ask it once. But is it the same points on a cat and a dog?
Yes.
For the most part?
Yes. The only difference, well, you can't really see it behind me. I should put it.
You kind of see it, but yeah.
Yeah. So on top you have the dog, on the bottom you have the cat. So the points are always at the same location, but the constitution of the animal can be different. Just like with us, the constitution is different. Let me see if I can bring that back. But for example, how I teach my students, for example, we have a point here on our hands. It's called large intestine 4. And then I tell my students, just imagine you are the animal, let's say the dog. So you put your hand down like he has his paw here with his little nails. And this is then the nail that goes up his arm. Well, it's at the same location. So just imagine that. And you can also always check specific points on Google. But otherwise, we have them all explained in the booklets that we have. So here you can see an example. Governance vessel 26 is here. Well, it's at the same place for us. It's at the same place for the dogs. It's at the same place for the cats. So once you learn the points on yourself or on one of your animals, you can always transpose them on any other animal. Just take into account that when we have our arms like, When we have our arms like this, a dog has his paws like this. So it's a bit different, but they are still at the same location.
Yeah, that's that's really good. And I think, so thanks for that. I think that's also empowering for those of us who are maybe on a surface level familiar with the acupuncture or pressure points, but then thinking, okay, if I can learn them for myself or on myself, that it's easier to transfer that to when you're going to apply it for your dog, your cat, or your horse, right?
The meridians are still on the same lines as for any other animal, right. Just the constitution of the animal that changed. So, of course, now I was talking about horses and cats and dogs and cattle. They all have more or less the same constitution, more or less. But I mean, for a bird, she still has the same bladder meridian like the other animals. Just a bird is a totally different constitution. Right. So it's hard to find. But then again, they are smaller, so most of the time it's even easier to find. But and on the fish, they have also meridians, but it's just a different constitution. So you can always look that up, or you can just have the information booklets and just look it up there.
Okay.
You don't have to know anything to do this. You just have to follow the recipe that Dr. Brian McLaren gives you. Look up the booklet that you need, torch those points with your red light, for example, for 5 seconds, depending on the weight, but it's all explained. And repeat that every 2 days for X time, depending on the situation. And it's that easy. And at the same time, you will save a lot of money, because you can use that same light, if it's the big one or if it's the small one, you can use it on any of your animals. It doesn't matter, and on yourself and on your kids and on your parents. It's one tool that you can use on anybody. And at the same time, you don't get the ulcers from lots of medication.
Yeah. Well, that's something that is of high interest to people. I know, I'm going to presume most people that are on here live wanting to learn that. And so that's really great. Now, I'm going to pull up some more questions, but when you're doing the treatment, so let's say you find the point, are you, and I know this is probably explained in the instructions, but is this like okay, good, 5 seconds, or is it like a minute or 30 seconds, or is it all vary depending on the point that you're applying based on what you're trying to treat, so to speak?
No, it's not like in acupuncture. In acupuncture, a needle can stay in for a few seconds, up to 20 minutes, for example, that it has to stay in. With the torch, it's always the same. It's, for example, let's take a Labrador. I will take a dog, a Labrador, as an example. That will be 5 seconds per point, no matter which point, every point, just 5 seconds. But if I take a horse that weighs 1,000 pounds, then I will use it 10 seconds per point. But that's it. And that's also where the torch differs a lot from any tool that it's called laser. Okay? But that's another team. It's with the monochromatic light and non-monochromatic light. The fact is, with the laser, when they put the laser on a point, as soon as the laser touches the skin, a lot of the light goes away. It shatters away. Okay? So all that energy is not entering into the skin. And therefore, when they use a laser, sometimes they have to use it up to 15 minutes for a specific zone. You don't have that with red light based on an LED. Okay, so and this one on 660 nanometers. That's the specific color range. And so, no, you just take your torch, you just put it on the point, and you just count to 5. 1, 2, 3, 4, 5. On a Chihuahua, 2 seconds will be enough.
Right.
So it just depends on the weight. And so it's never longer than 10 seconds per point. So in other words, within 2 or 3 minutes, every 2 days, you have given them their session. You don't have to drive anywhere. Okay. The only thing we say is you always have to know what the problem of your animal is. Let me give a human example again. Many years ago, I used to have a lot of headaches. I had migraines and so on, and I would use the torch, and my migraine would go away. My migraine would be a lot shorter, and it would go away. But X time later, I would get a headache again, or a migraine again. So, does that mean photonic therapy is not working? No, it is. I was not treating, or we shouldn't be using the word treating. I was not healing the origin of the problem. So I kept a diary for 2 weeks, writing everything down, what I was eating and I was drinking. And on the other side of the page, I would write down everything that was happening to me. And it's like that I found out that every time I would eat cheese or drink milk or eat yogurt, 3 hours later, I would get a headache. So it's the cheese, it's the lactose that was my problem. That was giving me the headache, which I could then torch away. But in other words, it means if tomorrow or tonight I'm going to eat cheese again, I will have that headache because my body just can't deal with the lactose. So what we say for anybody, if you have a problem with your animal, please first go to your therapist. Holistic or traditional medicine, it doesn't matter, but you need to know what's going on with your animal so that you don't only just torch his symptoms, but that you can work on the origin of his problem. Meaning, if your animal has an ACL torn and you have even no idea what's going on, how do you want to do the correct points? How do you want to torch the correct points for the healing process if you don't know what's going on? So it's always important to have a diagnosis from your vet, traditional or holistic, it doesn't matter, but have your diagnosis and then start torching those specific points for that problem to be able to heal your animal. The only reason when I say to not go to the vet is when you have an emergency. So your animal is bleeding, has been run over, or has a big cut, and so you have an emergency. No, take the torch immediately. Start torching that animal to stop the bleeding. Yes, we can stop any bleeding wherever in the body. It doesn't matter where it is, with just a few points. The same for an animal with heat stroke. Now in Australia, it's summer. Well, if your animal has an heat stroke, no, you don't wait till you go to the vet. You torch him immediately. That's why also for the dogs, for example, we have booklets with emergency points. The same for the human. If your partner is having a heart attack, do those points immediately. And then, or for the horse, your horse has a colic, call the vet, but meanwhile, immediately start torching the points so you can already start to help your animal because it's an emergency. If it's not an emergency, then pick up your animal, go to your vet, have a diagnosis of what's going on, and then take the torch to be busy with that.
That's a great, thanks for the detail there. This is another comment. Let me pull this out of here. Somebody had asked about the free gift, but the link didn't work. I think there we had that address, but can you repost that link again after? So yeah, so we'll put that.
The link you saw plus AWS behind it. But by the way, this lady, I did answer to you. I remember your message, and I have answered to you probably at a time in when our presentation was on. Maybe she didn't see it afterwards. That's possible, but it's no problem. It's just my website, advancedphotonic.eu/AWS, and you can ask for your free booklet. I mean, I've had over 150 people asking for free booklets, so the link did work for most of you, so don't worry about it. Just send it to me and I will answer you.
Well, I got you. I double checked the link while you were talking and it works, and I'll post it there for you. So yeah, and as soon as it shows up, yeah, here we go. So there it is, just advancedphotonictherapy.eu/AWS. So that's great. That's awesome, Eva. This one from, oh goodness, from here, Inbal. If I'm pronouncing your name correctly, I hope. I think, and Christina, Christina Chambreau is helping people on the comments, which is awesome. So what are your thoughts on this one here?
If a dog starts limping after a 15 minutes walk every time, does this mean she's in pain, or could it be something else? She has had crucial ligament surgery a couple of weeks ago. Okay, so first of all, she had surgery a couple of weeks ago. That also means that she should right now still be in rehabilitation, meaning the walks every day, she should be building that up slowly. So if that dog is already, if that dog is limping after 15 minutes walk, you are asking too much from the dog. That's one. Does this mean she is in pain? The word pain has different definitions. What I would use anyways, that she is in discomfort. That is for sure. And for me personally, it's not, well, not after this surgery. I'm talking about this surgery, the cruciate ligament surgery. You have to be building up slowly, because you do not want to interfere with the healing process. So that means, so in the beginning, it's really short walks. It's better, for example, for this dog with such a surgery, I'm going to the extreme now, but it's better for this dog 10 walks of 5 minutes than 3 walks a day of 15 minutes. Depending on the stage where she is, you need to build it up really slowly. Okay, because you never want to go too far. And if this dog is always limping after 15 minutes, you know this is not right. Can it be something else? Yes, it could be something else. But in the first place, I would think you should go to your vet, explain this, what's going on, maybe make a video for your vet so he can exactly see what's going on. But probably it's possible you may be asking too much of the dog. So what I would do, I would go to my vet for one. 2, I would bring those walks down. I would do more walks during the day, but shorter in time, to slowly build up the power of the leg to function, and never go over that limit. At the same time, make sure to torch him. After the operation, you can do that even a few times a day locally, just to take the pain away, and do the standard points and specific points for that leg every 2 days.
Okay, that's great. So that's awesome. And by the way, if I'm pronouncing your name correctly, Inbal.
No, it's correct.
Yeah. Okay. Just sometimes I whatever. Just want to make sure I'm got it correct. So Eva, I was going to say, can you try to tip your screen down, like forward towards you a bit? Just because when I pull the comments up, sometimes it cuts you off a little bit. Yeah, that's good, because then when I put the comments up here, then we're good to go. Okay. I missed Christina's question. This one, I think that about can it help with cat stomach cancer? I feel
it all depends what's going on and what you want. What it can do, it will relieve the pain. That's for sure. It can help with digestion, because you have points for all these things. Stomach cancer, I don't know what's going on. I'm not a vet. I can't make, I don't know in what stage your animal is. What you always can do is go and find a very good acupuncturist for animals where you live. Bring him all your documentation. Make sure if you have a holistic vet, bring it all to them. And depending on the stage, depending on what's going on, they will certainly be able to help. If the acupuncturist, you see, it's hard when you just give, okay, I have cancer. Yeah, okay, but which stage, what's going on, what, without a medical team seeing all the documentation, the blood results, the scans that have been made, the possibilities that there are, I cannot make, how do you say, I cannot talk about this. I'm not a vet, okay? So it all depends what is going on. I would suggest you find a good acupuncturist in your neighborhood, bring him, or a holistic vet, bring him all the documentation you have, ask for their help, and the acupuncturist can show you exactly which points you should be doing. What I can do from my side is I can, with photonic therapy, you can relieve the pain of the cat. You can relieve the nausea of the cat. You can help him with digestion, be it, well, for the whole gastrointestinal tract. You can help for all those regions. You can give quality of life. Am I going to say that you're going to heal the cancer? No, I can't say that. Yeah. I hope you understand.
For sure. And she commented again, saying how much does it cost for the laser torches and also any courses? So Christina, you might have off the screen again. Christina, you might have come in a little bit after, but Eva does have a lot. She has some great courses that are on her website, which I posted in the comments. You can just go to advancedphotonictherapy.eu, and she has a free gift that she was giving away during the summit, which I believe is still just going to be up and available. And that link is down below as well. It's just advancedphotonictherapy.eu/AWS. But Eva, why don't you hit on that while I give you a minute to read her question, which Christina sounds like my kind of person, Reiki practitioner, shamanic practitioner. That sounds awesome.
Yeah.
So talk to us about pricing, because I know people, the big elephant in the room, people are like, well, okay, this sounds really cool, but how much is it going to cost? And I love what you're going to share. So go ahead. So
Christina, first of all, it's not a laser. Just to make it clear, it's not a laser. This is a light with medical LED inside, so it's not a laser. It's not dangerous. I can look in the light without problems. I'm not gonna damage. It's not dangerous. That's one. Two. This is the old torch from the time from Brian McLaren. These are the new torches since 2016 and 2017. Okay. I paid a lot of money for this one in the past. I've brought all the prices down. Ooh, I was almost going to drop it, but then again, it can drop. It won't break. So no problem. We have a video, but I'll have to check it. We have a video that a car is driving over it. So no problem for that. These are the original torches. You can go on the internet. You will see there are a lot of red lights now on the market. The main thing for you to know is it has to be a 660 nanometer light. Has to be an LED. This is with a medical LED inside. This torch, which is the professional torch, or let me start with the baby. This is the pocket torch, okay, which I call the first health torch. It's so small, it's just like my finger, so I can just put it anywhere in the front of my jeans when I go horse riding, if I still would do that, and you can take it with you anywhere. This is a 127 euros, okay, plus VAT depending on where you live. Everything is included. I mean, you get the charger with it, you get the battery with it, you get the holster with it. I had some packs lying here. Hold on. Okay, let me open it. So you get the USB cable with it, you get a charger with it, you get plug in it, you get extra buttons and so on, and the holster and everything. So that's 127. And then the big one is 277, but this has 3 modes. The baby only has 2 modes. The big one has 3 modes. Mode 1 is to torch acupuncture points at 200 milliwatts strength. Second mode, mode 2, is strength of 500 milliwatts, and that's to torch locally, and that's what we want to use on the horse to bring energy straight into the aorta when the animal would be without powers. And the third mode is pulse light. Pulse light is what we use to stimulate the melatonin in the body. That will help us to not have any jet lag, for example, to sleep better. But at the same time, if you go to Google, you will see that scientists are saying that the pulse light will help to keep your brain working better. Meaning, they say that. I didn't say that. They say that it would prevent degeneration of your brain. So in other words, if you're supposed to get dementia, it will come a lot later. So that's what we use the third mode for. This torch is also a bit more expensive than the baby, because in this one you get 2 medical online sessions included, meaning something's wrong and you have no clue what to do, like with the lady, for example, with the cat with the stomach cancer. In that case, she can just send us the blood work, the scan results, all the results that she got from her traditional vet or holistic vet. And then our team of vets, acupuncturists, and me, we will go over it and we will see what points exactly this animal would need. So 2 sessions like that are included in this price. And what do I get as a result is that people say, yeah, but how can it be so cheap? Does it mean it's worse? Because they have seen this torch, for example. This Pro Torch came out in February 2017 and has meanwhile been copied in the United States, where it came out in October 2017. And I sell it at $277. They sell it at $995. So why is mine so cheap? Just go to my website and see the story. I am the one who has been suffering many years of my life. And when I took over, or it's not a word, that's not a good word, when I continued Dr. Brian McLaren's life work, I said, okay, but I'll do it my way. And my way is we should not earn a living on the suffering of others. So that's why I brought the prices down of the torches. And no, I cannot make a living with them. But that's not what I want. I mean, getting the smile for an animal that's in pain is worth more to me. If you're then asking, yeah, how do you make your money? Well, I teach, I give courses. I still work as a jurist. But that's what I want to do. I want to keep this low because I think that any animal deserves his pain to be taken away, or any human to take his pain away. And the biggest part that I've always heard in the past was people saying, I love it, but I can't pay for it. I don't have the money. Because what happens is that people that have pain or chronic diseases, or have animals with chronic diseases, they have been spending their money on doctors and vets, and they say, we have nothing left. And it's as a last resort, they come to me and they say, please help me. Yeah, I want to help you. I've brought all the prices down. And that's why they are so much cheaper than other torches that are in the market. It's not because they're worse. It's because I want to make a better world. I want that anybody is able to buy this, and that anybody is able to give themselves and their family and their animals a better life. That's my goal. And I know it is nothing. I am not a businesswoman. I know. I stink in marketing. I know. I'm not good on my website. I know. But my task in this life is to help heal peoples and animals and take their pain away. That's my goal. That's what I want people to remember me.
That's good. That's good.
Center.
And I was going to say, my encouragement for you, don't speak those words over you. You are good at it. And I admire your passion for this, because I think that it is something that it is making it more available. And I think, to be honest, regardless of what people, however the perception is of the price, I think it's amazing, because it's more obtainable and budget friendly, and so that people can use it. And I mean, the thing is, once you have it, you have it. Like you said, it's pretty indestructible. There's the rechargeable battery thing that comes with it. There was a lady here, by the way, I wasn't skipping over you. Oh goodness, now I might have skipped over her and not be able to find it, but she's from New Zealand and was asking Lynn here. So Lynn, I don't know what time it is if you're in New Zealand, but either way, good on you for tuning in here on the call. It's probably 3 or 4 in the morning. So I live in New Zealand. Is a torch compatible with our power, or is it simply battery driven? So this is great, because...
So what you do, Lynn, is you take your battery out, you put it in the charger, and you can use it then just with a cable, because it's a USB cable, in your car, on your computer, whatever. But on the other hand, you can also plug it in, okay? And I know I don't have to do this. By the laws in Europe, I have to provide only the European wall plug. But I have the wall plugs for Australia, I have the wall plugs for the UK, I have the wall plugs for America and Canada. So don't worry. Normally, yeah, just like Barney is showing, that's the plug for America and Canada. I can give you that one too, as long as I have them in stock. I'm right now waiting for the ones from the UK that I'm out of stock, but that's just a week. But anyways, even if the wall plug wouldn't be in there, you can just use it with your cable in your computer, in a wall plug that you have at home, or in your car, or wherever. And even if you load it once, you can easily work with it for a month.
Yeah, it does last quite a while, which is pretty awesome. So I think that definitely answered Christina's question about the pricing. And yeah, and just so you guys know, we're here to help spread the word. You know, how people ask us, like, why do you do the summit for free? I'm like, well, we make it so that anybody can be accessible to it. And for those of you who are paid members, we appreciate you. And if you're tuning in and you're a free member, that's totally cool too. We just always encourage those of you who are in a position to, or choose to choose one of our paid options, then it allows us to keep offering it for free. But we have even more in store for the paid options. And I say that because what Eva's talking about is that she's doing this clearly out of passion, and she can support herself financially in other ways. And I just think it's pretty awesome. And I agree with, I think Astaris, or is that how you pronounce it? I would say Astaras or Astaris, I think. But just to say, and appreciate your integrity. So really good. So let's go through a couple more questions to finish off here. There's the ones that were sent in. We got the ones who were here, as we usually say with a live training like this or a call. We do our best to get to the live ones.
You get the question up.
For those of you who show up live.
Get up 2 seconds too, because one of the rescues wants to get in. So I just have to open the door. Don't worry. I'll be right back.
Go for it. Yep. Okay, so I'm going to pull up the questions, and I don't. I saw you said this. So is it Astaris or Astaraz? The first way or the second way? Let me know, because I'm curious now. Yeah, and Christina's saying that totally wonderful. That will be your legacy. Respect. As someone who suffers from MS, fibromyalgia, and a lung disease, I know all about pain, and I'm so happy I can use this for my animals. Many, many thanks. And remember, Christina, you can use this, of course, on yourself as well. It's great that you can do it for both.
My neighbor has MS for the last, it will now be 35 years, I think. And she has been using the torch since 2009. Yep. And doctor still doesn't understand what she has been doing, because he says, what's happened to you? And she says, what do you mean? He says, I don't recognize you. She says, what's wrong? Are my results so bad? No, he says, you're so good. You can hold things again in your hands. You can walk better again. And this woman, since 2009, every 2 days, she keeps on torching herself. She says, I can't live without it anymore. And that's my neighbor here. Yeah.
Yeah.
You can use it for yourself. Don't worry about it.
Yeah.
Make your life better.
And that was one of the questions that was sent in, was, can I use this? Can I use the torches also for people? And what does it, so the other one, I'm going to paste it in here. I don't know if it's going to work for the timing, but what does it mean? Pardon me, guys, just 1 minute. See if this will show up in time for me to pull it up on the screen. But it says, what does it mean in professional torch that the lens is inside or on top?
Okay, I don't have the one. Well, anyways, so there is a lens in here inside, and I just like those torches better because, for example, I can put my finger inside and put the light on, which is easy for the nails of the dogs, for example, to do the ting points. And then I also have these torches with the lens on the outside, and that's most of the time the therapists will take that one because it's just easy to clean off. Otherwise, with the lens inside, you would have to go with your little paper inside and do it this way. That's the only thing. I just like to work with the lens inside or the lens outside, but there is no change in use of the light in itself. It's just easier to clean if you have the lens on the outside. That's all.
Perfect. And this is a quick one. Can it help with alopecia?
The question is, what's the origin of the alopecia? So what is not in balance in your body? So I've never used it for alopecia, but I do know that it has to do also something with stress and something autoimmune. So find out what the origin of the problem is. Check with Google, for example, what to do if you can use acupuncture, which I think you can. And anyways, if it's not going to bring a solution directly to the alopecia, it will certainly bring balance in your body. And when you bring it, it doesn't go from today to on tomorrow. And it's not a miracle tool. I mean, if they cut off my arm, I'm not going to get a new arm tomorrow. Okay, so it doesn't work that quickly either. It does work quickly to really take the pain away. If I torch these dogs that are all lying behind me, I torch them now, within minutes they're sleeping. I'm making those videos again now because I have a dog who was very sick one way because she became paralyzed after an operation. Sometimes you can have a result immediately. For example, she was constipated yesterday. She didn't go to the toilet for 40 hours. I torched. I'm filming everything at the moment with her. I torched, and within 2 minutes, everything came out. She couldn't urinate anymore. You do specific urination points. Within 2 minutes, or 3 minutes, it comes out. So sometimes you can have really quick results. But with other things like autoimmune diseases, now it will take time. Like with my fibromyalgia, I wasn't better from today on tomorrow. No. The objective is that you build up your immune system again, so that you become stronger, that you bring in the energy in your ATP system, which is the adenosine triphosphate system, which is in each cell of our body. You want to make everything strong again, and that takes time. But I mean, I don't remember, honestly, I don't remember how many medications I was taking for my fibromyalgia. I don't remember, probably because I don't want to remember. But within a month, I was off every medication. Did that go from today to tomorrow? No. And I just didn't realize it. I had to take medication in the morning, well, every 8 hours, in the morning, in the early afternoon, and then at night. And I was torturing myself. I was following the protocol from Dr. Brian McLaren. And suddenly I would come into the house and I would see that I forgot to take my medication. Oh, I didn't need it. I didn't feel that pain, apparently. And that's how slowly I started realizing with my fibromyalgia that I wasn't needing anymore. And so within the month, I was off all medications, every medication. So, and I've got my life back. Stress kidney and Graves' disease, I see here. Yes, all of that you can make better or bring balance with phototherapy. But now that I'm reading this, I would also advise you to watch out what you're eating, because several foods cannot be, you should not be eating related to this. You see, photonic therapy is brilliant, it's fantastic, but it will not save the world. Meaning, yes, I do have essential oils turning there because I like them, and some of them are good. For example, frankincense is very good for the dog who was paralyzed. She's starting to walk again, although she was going to be put down because they said she would never walk again. But on the other hand, this is the same for food. That dog had fever. Well, I will look at my food therapy, also from traditional Chinese medicine, and I will give her foods that will cool the body. Okay, so for example, if you have fever, don't eat ginger, because ginger will heat up the body even more. Things like that. So what I mean is, photonic therapy is my life savior. It saved my life. Thanks to photonic therapy, I am alive. But that doesn't mean it's gonna do everything. If I drink wine, a liter of wine every day, if I eat fast food every day, photonic therapy is not gonna save me, because I am ruining my body and brain on other levels. You see, so still take care of you. So if you know that you have a certain problem with your kidneys, watch out what you're eating. Don't eat anything that can put more pressure on your kidneys. For example, if you have stress, then think, for example, at night, I'm somebody who can have a lot of stress, and then I get psoriasis on my head. And well, at night before I go to bed, I do some meditation. In the morning before I get up, I do meditation. Bring it all down.
It's 14 hours.
There's my computer telling us what time it is. Okay, a couple more questions. There's about three more. We keep them tight, we can finish up and get through them all. So this one, I feel like you answered this, but why don't you just elaborate a little bit? Okay.
Difference between the online courses. The online courses, I have students from every continent. I have students from Australia, from America, from Europe. I have students from everywhere. The difference is one, I have a certificate course for the ones who want to do this professionally later on. That means we have the online part, and afterwards they have 6 months to do specific case studies, and we're together online a whole year. Then I have people who say, nah, I just want to know a lot more about it, and I want to have the private one-on-ones with you. I want to have the personal coaching, but I do not want to make it a profession. So they will only do the first 6 months, which is the online part, where we have modules every 2 weeks, where we have our private coaching, our private one-on-ones, and so on. And then the third online course is, I want to know about it, but I'm going to do it by myself. So that's the cheapest part, but you don't get in our group, in our Facebook group where we talk every day. You don't get the private one-on-ones. You just go through the same modules as all the others. And you do the exercises on your own, but I am not checking up on you. I am not gonna go over all the videos that you're gonna be making, and I'm gonna help you. This is correct. Yes, continue. Oh, watch out. This is not. No, then there is no personal touch from me helping you. So that's the 3 options. Going for the certificate, that's going all the way. That's the year. Online part, and then the case studies. Then you have the people just say not professional, just the online part. And then the people, no, I just want to know more, but I wanted to do it the cheapest way, so I'll do it on my own. Okay. You were also saying something about your academy. So this is all happening in in my academy. It's called the APT Academy. My academy has been recognized by the International Institute for Complementary Therapists. So I am an approved provider of these courses, and it also means that the people who do finish my courses in the certificate program, those who do finish successfully, they can do this professionally in their country and get liability insurance, which most of the time is very hard to do in the United States or in Canada, to get liability insurance without being a vet to do this. So this is all arranged with the IICT. Okay, another question. Is for the start enough that I purchased the dog and people info pack to start practice on my dogs and myself? Yes, absolutely. Dr. Brian McLaren has made it so easy that this normally, it's just with the pack, it's just sent to your home. And these books, by the way, they are not sent to you. You can now download them. So you can download them to your computer and then transfer them to your phone or your iPad or tablet, and even print them out if you want to. So this is just sent to your home. You just open it. You just read what you have to do. It's that easy.
Okay. There's 2 more. That's great.
Okay.
2 more, but it's not showing up yet. So until it shows up here on my end, sometimes there's okay, here we go. Christmas is coming. My dog is so scared for the bangs of the fireworks. Can photonic therapy help him? Yeah,
this is, for example, this is what I'm going to be talking about in my lives. At this moment, I do a live on my photonic therapy page every night where I answer a question from you or from those present. And Christmas is a big theme because now is also the time that you have to start. There are many solutions or ways to help your animal. First of all, you could use some CBD oil, you could use some herbs, you could use to get your animal trained to be listening to those sounds, starting from really low to going higher. But then again, I think that for the people from the Animal Summit who asked for a free booklet, I think more than 70% asked me for the fear booklets with dogs. Okay, so what do? You start torching your animal every 2 days, the fear points and the standard points. This will help him get stronger and less fearful. But normally this has been going on with your animals for years, so it's something that has become chronic. In other words, don't wait till the day before Christmas to start torching. No, do it now. By the way, that lady, there was a lady here before, Imbal, she has been writing to me too. She has been torching I think 4 or 5 dogs in the last month, all for this problem that's gonna come. They were all fearful, and she says now we had fireworks and those animals weren't even moving anymore. So yes, photonic therapy can help you absolutely, but you have to start now, this week or next week. Don't wait till the 20th of December. Do it now. And you can also, if you want to, you can also combine it together with some CBD oil or with Rescue Remedy drops from Dr. Bach. All of that is possible. Okay, how can I treat pain from arthritis in senior cats and after surgical procedure or traumas with natural meds at home? Have you tried CBD or other cannabinoids in cats? In cats, no, I'll be honest. I have tried CBD because I have a traditional vet. We don't have holistic vets where I live. And my traditional vet, I've known him for many years. He is really traditional and scared of everything. Well, not scared of everything. He just doesn't trust it because he hasn't seen it. It took him years to see to believe that photonic therapy was working. He needs to see it. He needs to feel it. And he got some CBD oil, which is called Chronic Care over here. And he asked me, he says, Eva, I received this from the lab. Please try it on your rescue. So I know. And yes, CBD oil, it does work. It does help with arthritis also to take the pain away. But for me, I will always use it in combination with photonic therapy because I want to do the healing part too. I'm not just gonna use it for the pain or whatever. I will use it in combination. Now, I have never used it on cats, so sorry, I can't answer you for that. I do use it for arthritis in my rescue cats that I have. Yes, I can use it. If you go onto the website, you will see we also have an information pack on cats. And I also mentioned all the points that for the specific situations that you can use it for. So have a look there, or come to me on my photonic therapy page if you want to know more. I saw a last question coming up, but it has gone again.
Oh, yeah, that was the one you just answered, and then this one. So do you offer installment?
Yes, Christina, there is a possibility to take the course and do it in 4 installments.
Okay.
So that's possible too. But for example, now something new I've done this year is that in the price for the certificate course, I'm also throwing in the all-in-one pack. That's my big torch and the small torch. Everything you need is in there. But of course, I can only send you then that pack when the payments have been done. You understand?
Yeah.
So yeah, but installments, no problem. You can find it on the website or you can just contact me.
Okay, perfect. Okay. And this one is pretty long, okay. But this is a lot. I think this is the second last one, and then we'll wrap things up here, okay. Which has been great because I know lots of great questions. And yeah, this one, while I'm waiting for it, I know FYI, Joanne said Copa Eva, which is an essential oil, contains more beta carotene than most CBD oils, which I've heard to be true. I don't know. We use Copa Eva every day for ourselves here in our family, which it's, for those of you, which, okay, I'm still here. It's an essential oil, but thanks for, what's that?
I have them. I think I have every essential oil there is.
Yeah. Okay, this one is a long one. Now, as you read it, I think it's really the last, sentence where they, it's Judith that was asking this question that was sent in. But really, I think bottom line is the question is, what can I use to control her pain and comfort? And I know what you're going to say, but let's hear it.
No, I just want to see because, for example, with Rimadyl, be really careful. Probably this dog, if it has been taking Rimadyl for some time, it will have stomach issues. Many medication have secondary effects, and Rimadyl is one that has effects on the stomach. So really watch out. So control her pain. That's torching her standard points and specific points. So it is in the shoulder blade. So you would do specific points for the shoulder and the standard points every 2 days. And then at the same time, you would torch daily over the zone where it's hurting. So torching locally on mode 2 of the Pro Torch will work as a painkiller, as what Rimadyl is doing. Okay? And it will just take the pain away. And it will take you, well, depending on the size of your lab, it will take you half a minute or maybe a minute for each session that you're going to give. And you will see that, look at my presentation to find out if your animal is in pain. I've explained that, all the physical signs and that you can see if your animal is in pain. Find it there, but I would torch locally once or twice a day, as long as she has pain there, and do standard points and specific points every 2 days. It will stimulate her immune system. It will bring up all those bubbles of the ATP system. So those cells are becoming stronger. Your animal is going to become stronger. And what happens is, the stronger your immune system becomes, your pain levels will change too. So you will feel less pain. But as long as your animal has pain, and certainly for the deep bone biopsy, please torch that zone. Your animal is, people don't realize this, but When you are able yourself to take the pain away from your animal, you become their hero. They love you, they adore you. My animals here, that it's dogs or horses, they put themselves in line to be the first to be torched. They see me with the torch, walking with the torch, they come, please give me a session. They just love it. Not only because they would be in pain or something, no, just because it relaxes them. It makes them go to sleep within a few minutes. They feel better. We are releasing endorphins, okay? And if your animal is in pain, there's only one thing you want, and that's to take that pain away and see the smile on your face of the dog. Instead of those eyes are, oh no, it's not working. So please, torch them every 2 days. Look for somebody in your neighborhood who has a dog, who has a torch, and start torching. For the ones who were interested in our torches, I deliver in America in 48 hours. So what leaves today on Wednesday is there on Friday, as long as you live close to an international airport, of course. If you're living days away from an international airport, it will take longer. But that's, anyways, that's what I'm ordering. Whatever leaves today should be there in 2 days. In Europe, it should be there tomorrow. So you don't have to worry. It doesn't take long for you to get what you need. By the way, for the person with that long message, I would also suggest to take yogurt to put the medication in. I have a video on my page where I show you. I have taught all the dogs here. They eat the yogurt from a spoon. Okay, I just give the spoon, they open the mouth, and it just goes inside. And I put all medication in there because the yogurt will also help your animal at the same time. Okay.
That's great. That was from Judith, and this last and final one here is from Karen. They emailed them into the teams here. So I think
for the minerals and lumps on his body, I cannot suggest any oils. Okay. What I can suggest is that you will. The other day, I got a message from somebody you know too, Barney, from Rachel Miller, and she says, "Wow, your torch works on the stains of our. When we get older, we get those little things on our face or on our body. How do you call them?
Aging spots."
Aging spots. And she says, "Oh, the torch has removed my aging spots. The torch is removing wrinkles." Yes, I know. So on the moles and the lumps of the body, put the torch on them. They will reduce them, except, for example, if it's a fatty lump. Okay? If the fat is inside, it can have another reason. So there again, you should check what you're feeding your animal and do standard points and specific points. And otherwise, just take the torch and go over the moles and surround the lumps of his body. But for oils, I cannot make any suggestion. I am not certified in that.
Yeah, and I'm not certified either. From experience, though, I would just suggest using something like frankincense or copaiba, even lemon would be good to just try. And the thing is, you start very, very small and just apply a little bit and see. But I think definitely the nice part, there's no contraindications whatsoever with the torch. And I think that's what's really unique about it. So Eva, it's been great. It's been awesome. And thank you so much for your time. And everybody on here, thank you for joining in. My encouragement to all of you is to go and check out, I know Eva, I said this before in a call with her, she's very humble about it, but my suggestion for you is to get your credit card out or whatever, go over and buy yourself, go buy one of the torches, because the thing is that it's not really that much. I know it that much or how much or expensive is all relative to our own perception. I totally get that sometimes maybe it's not in the budget, but maybe not right now, you save up for it. But it's something that, to me, I look at it as it's not a repeat sale. You purchase it, you have it, you use it, you can use it on your friends, your family, the neighborhood dogs, everybody. And you can, pardon me, I forgot to turn my phone off on a live video. But I just think that it's great. So I just think that even the work that you do is amazing. And at the end of the day, the only way that you can continue to keep honoring Brian and his work is by selling more of the torches. And I think more people, like Gary Young's mission for the essential oils in the Young Living world is to get the essential oils into every home in the world. And that's happening, even though they might not all be Young Living. but that's happening, and it's pretty cool. So I think that I just want to say thank you, and also for those of you who are here thinking, I know I think if I could be candid, I'd say that most people are not going to be thinking like, do I want to get one? It's really going to be, do I get one today or tomorrow, next month or next year? And then as you guys can see, Eva has just a little bit of passion for what she's teaching. And she's very helpful for questions, being available. And so I just think it's pretty awesome. Do you have anything else that you would like to say, Eva, as we kind of close things up and wrap things up for today?
I'm not here to sell anything. I'm here to help. So I don't care where you get your red light. Honestly, I don't care where you get your red light. I just tell you, please get one, and please start taking the pain away from your animals and from yourself. I do have a video on my YouTube channel that gives you 10 tips of what to look for when buying a red light. Because if you're gonna buy one, at least make sure that it has the right nanometers, that it has the right strength, that it's not a laser, and so on. You don't want that. But for the rest, buy it wherever you want to. Remember the following: we are giving our animals or ourselves like acupuncture sessions without needles. Imagine you go to the acupuncturist. It will cost you between 50 and 80 euros or dollars, okay? That was one session for you. But your animals have gotten nothing from that. And if you have a chronic situation, you will have to go back again and again and again. So within a month, you have your money back. Not only that, for the rest of your life, you can still use that same torch and treat everybody. Give them all the benefit of photonic therapy. So I got somebody this week who bought a torch, and she says, it was also a lady with a Labrador, and she says, my dog is on Metacam. It costs me 30 euros, which is, I don't know, almost $40 a week. She says, $40 a week, that's 160 a month, and he has to have this for the rest of his life. Give me the torch, please. I'm gonna save so much money. So just make sure it doesn't matter how cheap or how expensive the torch is that you are gonna buy. Just don't let your animals suffer. Just get you one wherever and take care of the pain, because you are going to change the life of your animals, and you are going to change your own life. You won't have to give all those medications. He will feel better. He's going to live longer, a healthier life. So if not for you, do it for your animals.
Coming from Eva, who's saying she's not a saleswoman, you just no, I know, but this is the thing. It is, I'm telling you guys, if Eva's not going to tell you, I'm telling you. And by the way, I don't earn a single cent of anything. Eva graciously sent me one for free, and I want to say thank you. I really do appreciate that, but that's not the reason that she's on the call today. This was last year, but I believe in transparency and being integral in this. Is that I don't earn. If I was promoting Eva's work for a commission, I would tell you guys, say, hey, go buy one. I earn a commission. I don't feel bad about it, but I'm not. And this is lady here, Joanne. By the way, Joanne, thank you for your comments. You said thank you, Eva and Barney, for the good work that you guys do. Christina says, thank you for your passion. And Joanne said, just want to say no brainer, I'm going to get me one. And I think if you're going to buy one, buy it from, for me, this is just my opinion when it comes to the essential oil world. I don't want to divide the conversation here, but I always like to look at where did the originators and the pioneers come from. I want to follow those people, not the imitators and the duplicators. And that's why I loved learning directly from Gary Young before he passed. And this one here, Barbara, I will put the comment up here in a second, but we do have, that and this. So yes, but I think she's asking about the replay. This is a replay.
I see the question on the top. She asked for the name of the channel. The channel on YouTube is Photonic Therapy. Okay.
Yes, so that's good. And unless she's asking, this will be on YouTube. I thought she was asking about the replay of this. Which
sorry.
No, it's okay. It's good. That's good for YouTube. But I was going to let you guys know that we have, so these calls, we had them before privately for the VIPs, but it was a unanimous decision on behalf of many of the VIPs that said there's so much like golden nuggets of wisdom and content that is being shared in these calls every week. And so we kind of looked at it where it's like, okay, well, what are we going to do in between the summit? The summit is a massive event. It's a huge undertaking. You know, we do it for free, but it's not free to put on. And so these calls are something where we set aside time every week as of right now, 1 p.m. Eastern time, where we get on. We're going to now do them in this format where it's like a a Facebook Live. And then for those of you who are like, I'm kind of actually shocked as how many people are like anti-Facebook now ever since that information came out. But the thing is that Google and all the other big platforms that we use, our data is out there. You just have to know that when you're on the internet, your data is out there. But that if you're not on Facebook, that you can watch this. So this video will be up on YouTube tomorrow. So if you're watching this as a replay, it's redundant, but it'll be up tomorrow, December the 6th. And you can just go to just animalwellnesssummit.com, and we'll have a playlist of all the calls. And then those of you who are members, you can go right into your members area and just go to coaching calls, and they're going to be all in the website there. And then for the VIPs, what we've done now is instead of having these coaching calls, now that they're open up to everybody, you guys are getting the monthly mini master classes. And I know Eva's definitely put her hand up for that. So she'll be a presenter presenting on a specific topic. And it's a focused training that is going to be about 60 to 90 minutes on a here is blank topic. And that's included for the VIPs. And then those of you who are not VIPs, and you're like, wow, I want to take that course from Eva, then you purchase it through us. We're working together in partnership with all the presenters. And then we're going to help to facilitate all the customer service and all that stuff. So Eva can just do clearly what she does best, which is teaching. And then we help them with the marketing part. And the reason I'm telling you that is because I know that the question's going to come up with saying, if I'm not a VIP and I want to take one of those trainings, what do I do? Well, you can purchase them how I say it, a la carte, or you can just choose which one you're interested in. So yeah, that is my little spiel for today. And thanks again, Eva. I really appreciate it. And I know you give us some final words of wisdom. And Joanne will close us off with, of course, always go to the source.
Okay. And I have to go because I'm teaching in 7 minutes.
Yeah, that's good. Okay, guys. Well, thank you very much. Have a great day, or in Eva's case, have a great rest of your night, or the people in New Zealand, enjoy the rest of your day.
Thank you for having me, Barney.
You're welcome. Thanks. See you guys.
Okay. Bye-bye.
Bye-bye.
Bye, everybody.